Right now, while you're watching this video, high blood pressure could be putting extra strain on your kidneys, and you may not feel anything at all. That's what makes this connection so easy to overlook. Many people think of high blood pressure as simply a number on a monitor, but that number represents the force of blood moving through your blood vessels, and over time, consistently high pressure can damage the delicate blood vessels inside your kidneys. If you've been told your blood pressure is high, even if you feel completely fine, or if high blood pressure runs in your family, this video is for you. Because once you understand how blood pressure affects your kidneys, you'll know what numbers, warning signs, and tests are worth paying attention to. Before we get into the science, I want you to think about this. Your kidneys are quietly working right now to filter your blood, remove waste, and balance the water and electrolytes your body needs to function. They're doing this all day, every day, without you thinking about them, just like your heart or your lungs. But unlike your heart, which gives you obvious warning signs, chest pain, shortness of breath, your kidneys can be badly damaged, and you'll feel almost nothing. No ache, no tingling, no sign at all. That's what makes kidney damage from high blood pressure so dangerous. It sneaks up on you, and if you're over 50, or if high blood pressure runs in your family, your kidneys are working harder than most. You might be experiencing some of the early symptoms of this damage right now and simply dismiss them as just getting older, or maybe I need more sleep. We're going to change that today. The good news, and this is important, understanding how this happens isn't meant to scare you, it's meant to empower you, because once you know what's happening inside your kidneys, you can actually do something about it. So let's walk through exactly how this happens, what to watch for, and what you can do starting today. To understand how high blood pressure damages your kidneys, you first need to understand what blood pressure actually is and why your kidneys depend on it so completely. Your blood pressure is the force of blood pushing against your artery walls as your heart pumps. When your doctor measures it, they give you two numbers, like 130/80, for example. The top number is systolic pressure, the force when your heart relaxes between beats. But here's the crucial part. Your kidneys need a specific amount of pressure to do their job. Think of it this way. Your kidneys are like a water filtration system. But unlike a simple water filter in your kitchen, your kidneys don't just strain out large particles. They're constantly filtering blood under precise pressure to separate waste products and excess water from the blood cells and proteins your body needs to keep. For this delicate filtering process to work, you need enough pressure to push water and waste products across a barrier, a semi-permeable membrane inside your kidneys, called the glomerulus. Too little pressure, and the filter gets damaged. Now, here's where it gets interesting. Your kidneys actually help regulate blood pressure. They do this by controlling how much water and sodium, salt, stays in your blood. Less water equals lower blood pressure. More water equals higher blood pressure. It's a feedback loop. Your kidneys are constantly adjusting this balance to keep your blood pressure in a healthy range. That's why people with kidney disease often develop high blood pressure as a complication. The damaged kidneys can't regulate water and sodium properly, so blood pressure creeps up. But when blood pressure stays too high for years, and we're talking the delicate blood vessels inside those nephrons, the tiny filtering units, start to suffer. Now your kidneys have about 1 million of these nephrons, working in parallel. One damaged nephron doesn't immediately cause problems. But when you have high blood pressure for years without controlling it, you don't damage one nephron, you damage many. And unlike liver cells or skin cells, kidney cells don't regenerate well. Almost nobody realizes this, but your kidney function can drop by 50% before you feel anything wrong. You can lose half your kidney function and still have energy, clear urine, no pain, nothing. The damage is so quiet that most people only discover it when they get a routine blood test for something else. Here's what's important about this. The relationship between blood pressure and kidney damage isn't linear. It's not like you need exactly 120/80. Your kidneys can handle some variation. But the higher above normal your pressure goes, and the longer it stays elevated, the faster the damage accumulates. Someone with blood pressure at 160/100 is damaging their kidneys much faster than someone at 130/80. So the first step to protecting your kidneys is understanding that this isn't just about the number on a monitor. It's about a physical force applied relentlessly to delicate structures inside your body that you only have one pair of. Now that you understand the basic anatomy, let's look at what actually happens when blood pressure stays too high. This is where the damage accelerates. Inside your kidneys, the blood vessels are incredibly small and delicate. We're talking vessels that are only a few cells thick. They have to be that thin to allow for filtration, to let water and waste slip through while keeping proteins and blood cells where they belong. But this thinness also makes them vulnerable. When blood pressure is elevated, you're essentially running too much force through too thin pipes. And like any pipe under pressure, the wall starts to suffer. The innermost lining of these vessels, called the endothelium, starts to develop tiny cracks and damage. This might not sound like much, but it's the beginning of a cascade. Once the endothelial lining is damaged, your immune system responds. It sends inflammatory cells to the site. These cells are trying to help, trying to repair the damage, but instead, they trigger a scarring response. Smooth muscle cells in the vessel wall start to multiply and thicken. The vessel becomes more rigid and narrower. The scarring is called glomerulosclerosis, and it's essentially the kidney's version of scar tissue after an injury. The problem is that this scarring isn't a one-time event. With chronic high blood pressure, the cascade keeps repeating. More pressure, more endothelial damage, more inflammation, more scarring, and each cycle tightens the blood vessels and reduces blood flow through the kidneys. Here's where it gets interesting. As the blood vessels narrow and stiffen, it takes even more pressure to push blood through them, so your kidneys respond by triggering mechanisms to raise your blood pressure even higher. This is a vicious cycle. High blood pressure causes vessel damage triggers higher blood pressure causes more damage. But that's not even the whole story. The damaged blood vessels start to leak. Proteins that should stay in your blood start to slip into your urine. A kidney doctor would call this proteinuria or albuminuria, protein in the urine, and it's both a sign of damage and a cause of more damage. The proteins trigger inflammatory responses in the kidney tubules, which leads to more scarring and more function loss. At the same time, the glomerulus, that filtering structure, is changing. The basement membrane, the filter itself, starts to thicken and harden. It becomes less selective. Sometimes it lets through things it shouldn't. Sometimes it blocks things it should let through. What researchers found next was unexpected for many patients. The damage isn't uniform. Your overall kidney function numbers might look almost normal, even though significant damage is already present. And here's a detail most people miss. Not everyone with the same blood pressure level develops kidney disease at the same rate. Genetics matter. Some people's kidneys are more sensitive to pressure damage. If your parents or grandparents had kidney disease, your kidneys might be more vulnerable. African Americans have higher rates of kidney disease from hypertension than other populations. This is thought to be a combination of genetic and social factors. Age matters too. The longer you live with high blood pressure, the more time the damage has to accumulate. This next one catches almost everyone off guard. Some of the blood pressure medications actually help by reducing this inflammatory cascade, not just by lowering the pressure number itself. ACE inhibitors and ARBs, for example, don't just lower blood pressure, they also reduce the scarring response inside the kidneys. This is why your doctor might recommend a specific class of blood pressure medication if you show signs of kidney damage. It's not arbitrary. The damage from high blood pressure is real, it's physical, and it happens at the cellular level. But it's also silent, progressive, and often reversible if caught early and treated aggressively. One of the most common questions I hear is, how long do I have? If my blood pressure has been high for 5 years, is my kidney damage already severe? The answer is complicated, and it matters a lot. The timeline for kidney damage from high blood pressure depends on several factors. How high is your blood pressure? How long has it been elevated? Are you diabetic? Because diabetes and high blood pressure together damage kidneys much faster. Do you have other conditions like obesity or high cholesterol? Are you taking blood pressure medication? If your blood pressure is mildly elevated, say consistently in the 130 to 139 over 80 to 89 range, you could have this for years with minimal kidney damage, especially if you're managing it somewhat. But here's the critical part. Minimal doesn't mean no. At this stage, you might already have some endothelial damage and early scarring. You just haven't lost enough kidney function for it to show up on a standard test. If your blood pressure is moderate, 140 to 159 over 90 to 99, and untreated, you're typically looking at progressive kidney function loss over years, not decades. If your blood pressure is severely elevated, 160 over 100 or higher, and especially if it stays that high, kidney damage can accelerate rapidly. kidney function might decline 2 to 5% per year or even faster. At that rate, you could lose significant kidney function in a decade or less. But here's what most people don't know. There's a grace period. If you develop high blood pressure at 45, but don't do anything about it until you're 55, and then you successfully control it for the next 10 years, you're in a better position than someone who continues to ignore it. The damage you've done isn't instantly reversible, but if you stop the insult, if you get your blood pressure controlled, but some of the inflammatory processes reverse, some kidney function can actually be restored, especially in the early stages of kidney disease. The damage becomes much harder to reverse once you reach stage 3 kidney disease or beyond. At that point, kidney function is down to 30 to 59% of normal, and the scarring is more advanced. You might slow further loss, but you can't get that function back. Almost nobody realizes that the age you develop high blood pressure matters enormously. Someone who develops it at 65 has maybe 15 years. The total exposure time determines total damage. 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 There's one detail most people miss. Even if your blood pressure seems controlled, you might still be experiencing gradual decline if the control is partial. Blood pressure medications work best when taken consistently, as prescribed. Many people take them inconsistently, skipping doses, not refilling, stopping because they feel fine. During those gaps, damage continues. This next one catches almost everyone off guard. Kidney damage from high blood pressure can be progressive, even with treatment, just at a much slower rate. The goal isn't always to stop it completely. It's to slow it down enough that other factors of aging don't outpace the kidney function you have. You've heard magnesium glycinate can help you sleep deeper, relax your nerves, calm leg cramps, and support your heart. And it can. But there's one mistake, one tiny habit that can turn this gentle mineral into the exact opposite of what you hope for. Instead of settling your body, it can snap you awake at 3 a.m., tighten your chest, and push your heartbeat into overdrive. Most people never realize, but the window for prevention is wider than most people think. Even if you've had high blood pressure for years, getting it controlled now still matters enormously. Now, here's the thing about kidney damage from high blood pressure. There often aren't warning signs in the early stages. That's what makes it so dangerous. But there are signs you should watch for, and many people dismiss them or attribute them to other things. The first sign is something you can't see directly, but your doctor can find it. Protein in the urine. That's a sign that your kidney filter is leaking. It doesn't necessarily mean you have advanced kidney disease, but it means the filter integrity is compromised, and it's a red flag to take your blood pressure control seriously. Almost nobody realizes this. Kidney disease often develops silently alongside high blood pressure for years. You feel fine, you have energy, you're living your normal life. But inside your kidneys, the nephrons are closing down one by one, and your remaining healthy nephrons are working overtime to compensate. By the time you act, this happens because damaged kidneys produce less erythropoietin, a hormone that triggers red blood cell production. Fewer red blood cells mean less oxygen to your tissues, which means fatigue. Swelling, specifically in the legs, ankles, or around the eyes, can be another sign. This happens because damaged kidneys can't regulate sodium and fluid properly. Fluid backs up in your tissues. Some people notice their shoes fitting tighter by evening, or their rings getting snug on their fingers. Others see puffiness around their eyes in the morning. Here's where it gets interesting. Urinary changes can be a sign. Maybe you're going to the bathroom more often, especially at night. Or maybe the opposite. You're urinating less and your urine is darker or foamy. Foamy urine specifically suggests protein is being filtered into your urine. Changes in appetite or metallic taste in your mouth can occur. This is due to uremia, the buildup of waste products when kidneys can't filter efficiently. It's a sign that kidney disease has progressed fairly far, though. What researchers found next was unexpected. Blood in the urine, even microscopic amounts that you can't see with your naked eye, can indicate kidney damage from high blood pressure. Swelling could be from venous insufficiency or medication side effects. That's why getting proper testing is crucial. You can't diagnose kidney disease from symptoms alone. This next one catches almost everyone off guard. Sometimes there are no signs at all. Your kidneys function at 50%, and you feel completely normal. This is why routine blood tests matter so much. A simple creatinine test and estimated glomerular filtration rate, eGFR, can reveal kidney damage that you have no symptoms from whatsoever. The bottom line, if you have high blood pressure, you should have your kidney function monitored regularly. This means at minimum an annual check of creatinine and eGFR. If you have any signs of protein in your urine, more frequent monitoring. And if you notice any of the signs I mentioned, fatigue, swelling, changes in urination, especially if they develop gradually, talk to your doctor about kidney function testing. You can't diagnose yourself, and you shouldn't try. But you can be alert, you can advocate for testing, and you can take blood pressure control seriously. Alright, so if you've been watching thinking, oh no, I have high blood pressure, am I doomed? The answer is no. Not if you act now. Here's what actually matters, starting today. First, know your numbers, and I mean both of them. Not just my blood pressure is high, but the actual systolic and diastolic readings. Better yet, get a home blood pressure monitor and track your readings over a few days or a week. This gives you a real picture of whether your pressure is consistently elevated or just high at the doctor's office, which actually happens more than you'd think. If your home readings are consistently 130/80 or higher, or if you're seeing readings in the 140s or 150s, this is a conversation to have with your doctor immediately. Almost nobody realizes this. The guidelines for what's normal have actually gotten stricter. For many decades, doctors thought 140/90 was the cutoff for treatment. Now, the American Heart Association recommends less than 130/80s for most adults, especially those over 50, because data clearly shows that keeping pressure lower reduces both cardiovascular disease and kidney disease. If you don't have high blood pressure yet, but it runs in your family, you can start now. And no, this doesn't necessarily mean medication. For some people, lifestyle changes make a real difference. Reducing sodium intake, not to zero, but genuinely reducing it, losing weight if you're overweight, regular physical activity, limiting alcohol, managing stress, and getting good sleep, these aren't platitudes. And even if you do need medication, these changes make the medication work better. Second, if you have high blood pressure and you're not on treatment, or your current treatment isn't controlling it well, have a direct conversation with your doctor about kidney protection. If you have any signs of kidney damage, protein in urine, declining eGFR, the choice of blood pressure medication actually matters for your kidneys specifically. ACE inhibitors and ARBs offer specific kidney protection beyond just lowering pressure, so does a class called SGLT2 inhibitors, which were originally developed for diabetes but are increasingly used for kidney protection. In people with high blood pressure and early kidney disease, there's one detail most people miss. Medication names matter less than the class. If one blood pressure medication causes side effects, another in a different class often works fine. Don't assume one medication represents all options. Some people stop blood pressure treatment because they had side effects, when really they just needed a different medication. Third, have your kidney function tested regularly. If you have high blood pressure, you should have a creatinine test and eGFR calculated at least annually, more often if you have signs of kidney disease or diabetes, alongside your high blood pressure, and keep a record of these numbers over time. You want to see your kidney function stable or improving, not declining year over year. What researchers found next was unexpected. Some people actually recover kidney function when they get their blood pressure under control, especially in the earlier stages of kidney disease. This doesn't happen for everyone, but it's possible. The scarring isn't always permanent if you stop the insult. Almost nobody realizes this. If you already have reduced kidney function, some medications that work well for blood pressure in people with normal kidneys aren't appropriate. For example, NSAIDs like ibuprofen can harm kidneys. Your doctor needs to know your kidney function to choose medications safely. This is another reason why that simple kidney function test is so important. This next one catches almost everyone off guard. Some supplements that people take for heart health can harm kidneys. If you're taking anything beyond standard multivitamins, Run it by your doctor, especially if your kidney function is reduced. Finally, don't put this off. If you've been meaning to get your blood pressure checked, or you know it's high, but you haven't done anything about it yet, or your last check was years ago, make an appointment this week. The damage from high blood pressure is silent, but it's real, and every year you delay is another year of silent damage accumulating. And in some cases, you can actually improve it. That silent destroyer doesn't have to define your future. Your kidneys have been working quietly for your entire life, filtering your blood, maintaining your balance, keeping you healthy. And your blood pressure, that force that's supposed to be a partner in that process, can either protect them or destroy them. The difference often comes down to attention. Paying attention to your numbers, paying attention to how you feel, paying attention to whether you're actually taking that medication, not just having it in your cabinet. Not if you catch it early and treat it seriously. Your kidneys are forgiving. To a point. They want to stay healthy. You just have to give them a chance. If you found this helpful, please subscribe. Drop a comment if you have questions about your own blood pressure or kidney health, or if you've been through this journey and want to share your story. And remember, the best time to protect your kidneys was yesterday. The second best time is today. Don't wait for tomorrow.